and welcome to the Amplifying Scientific Innovation video podcast. I'm your host, Dr. Sophia Ononye-Onyia, founder and CEO of the Sophia Consulting Firm, a WeBank certified life science marketing and communications consultancy that was established in New York City with the goal of amplifying scientific innovation. The goal of this podcast is to showcase the importance of science advocacy, health equity, and influential leadership through conversations with senior life science leaders who will share their unique perspectives on their leadership journey, corporate vision, and industry outlook. My guest today is Dr. Irene Dankwa-Mullan, Chief Health Equity Officer, Deputy Chief Health Officer, IBM Watson Health, and a member of the IBM Industry Academy. IBM Watson Health aspires to improve lives and give hope by delivering innovation to address the world's most pressing health challenges through data and cognitive insights. Irene and I connected through her amazing sister, Ina, Executive Director and Head of Technology Operations and Risk Government of Programs at Morgan Stanley, whom I met at the 2019 Face-to-Face Africa 2019 Gala, where Sabina was recognized as one of the 30 Black stars. Sabina subsequently introduced me to Irene based on our mutual interest in health equity, not to mention our shared West African heritage. And earlier this year, Irene was actually a guest on a Healthcare Businesswomen's Association New York COVID vaccine event that I moderated as a chapter of HBA New York. We also both recently attended her sister's traditional wedding a few weeks ago, and it's a pleasure to welcome such a highly accomplished physician, executive, author, health equity advocate, and fellow West African to the show. Welcome to the show.
Thank you, Dr. Sophia. You are so kind. I am so delighted to be here. Thank you for the invite.
No, it is an honor and it's a pleasure to meet you, Dr. Irene. You have the utmost humility in the way that you present yourself, and you're so eloquent and so well accomplished. I can't even find the right words to define what you do. And that's why I'm deeply honored to have you as a guest on the podcast today. So I'm going to start with what is my favorite question, which is, what is your definition of scientific innovation?
Wow, that is a great question. So I published a paper a few years ago in the scientific journal around paradigm shifting scientific research, which is the end process of an innovation, right? So I talked about breakthrough or disruptive innovation that creates a category or changes an existing category more dramatically and makes, an existing thought or idea obsolete. So I will define scientific innovation as turning a creative or brilliant or great idea into a solution or into a technology or an invention, and one that adds value and that's relevant for everyone, and at the same time inspires amazing possibilities. So I would say that with this paper, I did mention, I talked about more of not just scientific innovation, but the one that shifts a paradigm. And in the paper in which I led, I described 3 characteristics of paradigm shifting scientific innovation, but it's also scientific innovation, right? And I said there's 3 characteristics. It should be translational, it should be transdisciplinary, and it should be transformational. It's transformational because translation. So it's translational because it builds on a foundational substrate or basic science. So I'm talking about the healthcare space or health space, or it builds on a basic science. The science could be social, political, biological, right? So a science discovery, and it translates into something practical, or an applicable strategy to improve our human welfare, to improve health outcomes. And it should be transdisciplinary because it leverages the synergy that's created by a lot of interdisciplinary or multidisciplinary science, so that we can understand, we can create, promote this sort of novel research perspective or idea. And the third T is transformational, right? Because it radically changes our understanding of an existing scientific or concept, an engineering concept or an idea. And most often it's a high risk idea. And so it requires some sort of structural or systematic or some process change for this innovation to make an impact. So I then, sometimes when you ask about what scientific innovation, they talk about, oh, a great idea. But I think to really make an impact and to be transformational, you need these three T's to be translational, transdisciplinary, and not just have a few people, and then it should be transformational. And it takes vision, it takes perseverance, and the key is making sure you're involved in different backgrounds and expertise and collaborating in order to transform this idea into something that's tangible, real, improves human outcomes, welfare for everyone.
Wow. I feel like I should start clapping at this point. I love the three T's. I think that that's actually a very quantitative and qualitative way to define scientific innovation. And, serendipity is such an important path in our journey. I imagine your definition of scientific innovation is also one of the things that attracted you to IBM Watson Health, because part of their mission, as I mentioned earlier, is to deliver innovation. And how do you do that? Through data and cognitive insight. So you have to have something quantifiable, transdisciplinary as well. So impeccable definition. I love it.
Thank you.
Yeah, welcome. And you were born in Ghana, and but actually, I want to find out more. How did growing up in West Africa influence your interest in addressing health equity?
Yeah, I think my cultural upbringing in Ghana definitely influenced my interest in health, in medicine, and in public health. So, not health equity as yet, right? But I think when I was young, around 11 or 12, definitely past age 8, when I wanted to be an air hostess and travel the world, I knew I wanted to be a scientist or a doctor. And my interest in health equity gradually evolved. But definitely, you're right. I think it's my cultural upbringing, my early experiences within the healthcare environment in Ghana influenced my desire to choose medicine and science. But I did realize there was a disparity more along the lines of socioeconomic status, even though maybe it wasn't I didn't fully understand the social determinants and those influence. But I was motivated and inspired by my family, especially by my grandfather, my dad's father, who grew up in colonial Ghana. He was the first and only Black African, right, to be hired as an account clerk at the Ghana Consolidated Diamond Mining Industry. And because he was the only person in his family to complete a primary and secondary education, and one of the few educated in the town of Equity, which was his hometown. And so the British owned and managed it. It was these days before independence, and all the Blacks would work underground in the mines. And my grandfather was the only one who worked as a clerical assistant. So imagine, right? He made a little bit more money. He was able to save up all his money. He saw that the whites had like good health care and they had different, segregated resources, and he saved up all his money, apparently saved up to 5,000 pounds.
Wow.
And then the land in which they owned, his family land, he used the savings to build the very first hospital, St. Dominic's Hospital, in his hometown of Aquatia.
Wow.
Yes. And then he and his family worked together around the hospital. There were Catholic nuns from Germany who had come to sort of, were part of um, the missionary, right? And they were helping in the region as well as in the hospital. But just for, an education that to really help him see that there was much needed health services and that this would bring economic, prosperity to the region. This would, and the fact that the work of the hospital and administration extended beyond the hospital was also very innovative. So when you go there, there was primary care prevention screenings in the churches, the marketplace. They were, going to where the families lived. So I think the environment where this a solid primary care infrastructure was essential to keeping a population healthy was inspiring to me. Because even I do not recall annual health screenings or prevention to the pediatrician, right? I remember receiving vaccination in school. I remember getting sick with mumps and chickenpox, going to a school health nurse who took care of sick students, in the school. So I think I did have this, I learned from my grandfather, his wisdom, his life experience, that your level of education was a way of getting a better chance. And then I realized how that was the social determinant of health. And it taught me to give back, to fight for equality, because that's what he did. And so that was, in a way, yes, inspired me to go into health and then health equity. And that's why I'm, doing what I'm doing today, in addition to so many role models and influences in my life.
Yes, and we're going to get into your mentors a little later in the conversation. So thank you for walking us through that beautiful story and teaching us a little bit about colonial West Africa and what it feels like and how grandparents, our ancestors, can play such a pivotal role in who we become just by the decisions that they make. So by emphasizing education so early on, you were inspired, and that's part of the reason why you are who you are today. So thank you for that. Now, there's another transition I want to talk about, which I'm naturally curious because we both have master's degrees in public health, which shows that we love the public health sector. So what inspired your transition from the NIH to your current role at IBM Watson Health?
Well, so I get this question a lot. And I think it was my intellectual curiosity. Not just for science, but my motivation for challenge and self-growth, inspired my transition. I would also say that my late husband, Fitzmullan, was very supportive of my transition, so it helped a lot. But a few other factors also inspired me. One was the long-standing mission of equity, diversity, inclusion that was a part of the IBM culture, right? So before I transitioned, I was like, okay, I'm going into the corporate environment. I need to understand the company's value and culture, right? And I think I was inspired by that and their long-standing 100+ years, right, of working at cutting-edge technology. And now it was the era of AI and big data. So it was exciting, right? And for the position at that time, my boss, Dr. Curie, was a champion for health equity. But the icing on the cake was Jeannie Rometty, who was at that time was female and was the CEO, and talked about how she was inspired by potential of AI in healthcare. She was excited about innovation that IBM was embarking on. And it was the era of precision medicine and big data. So that was, I think definitely that really was inspiring, knowing that there were, the culture of the company. I was also working in big data, precision medicine had been launched at the NIH. And there was all this excitement around the potential. So, but I would not say it was an easy transition because I had to learn a lot and quickly adapt to corporate culture industry.
Yeah. And that is a dynamic process, isn't it? Adapting to a corporate culture, because it's ever changing, right? Pre-COVID,
Yes.
COVID, just without even adding any of the internal factors. But, thank you for sharing that response. I absolutely adore your passion for intellectual curiosity, because I think that's the same thing that drives me to get new
Yes, you
ideas,
too.
right? Yeah. Anyway, my next question for you is bringing it back home to, I guess, IBM Watson Health and IBM. They're both, of course, doing some exciting work in the health equity space. Can you provide a top line overview?
Oh, yes, absolutely. I do enjoy what I'm doing. It's so much meaningful. There's a lot that's going on across IBM Watson Health and even IBM at large, right? So um, the I think a company that has this culture of a social mission is really critical to advance in health equity, social justice. And at the beginning of 2020, so when the pandemic hit and there was all this social justice, racial justice movement, IBM unveiled an Embrace initiative. And so did a lot of revamping, right? So there was a technology for good, social good, and a code Embrace, so EMB and then race, right, in bracket, where it basically, had all of us pledge to promote racial justice. And a call for code Embrace challenge has been implemented basically to tackle technology solutions to address systemic racism. And it has elevated over 400,000, community members, sort of a global initiative to think about social and racial justice issues for technology. We have a driving inclusive language in technology to ensure that our language, we don't reinforce discriminatory stereotypes. Our nomenclature is like, instead of saying websites that would say blacklist, right? Or hackers who violate IT security, right? Or black hat, we're like removing all that from the language. We also working on preventing bias. That's what I'm doing a lot of my work as well. AI bias, promoting privacy, fairness, AI explainability. And also another exciting thing is racial design, equity. It's called Design Justice for Racial Equity. And so we're looking to transform all of our design and product development process and making sure it's inclusive. So, and I think one thing where IBM Research has established a racial and social justice visiting scholars program. So they're working on projects to really focus on social and civic issues, health, education, criminal justice. So there's so many, really exciting and collaborative efforts going on at IBM, which is really great and hopefully making an impact.
Wow. I mean, obviously it's making an impact. I mean, just thinking about AI from a diversity perspective, right? How many times we sometimes get frustrated that you have to have a lot of lighting in your background for your phone to recognize your face, right? There are things like that we all struggle with. But I think the future of healthcare is it's on our wrist, it's on our fingerprints, it's everywhere around us, right? It's what we carry out with us, our digital devices, our wearables, etc. So I think how you integrate that into health, also thinking largely around social justice and of course health equity, that is truly remarkable. And it seems like an ideal fit for someone with your kind of background.
Yes, thank you. Making sure all of our tools, services, technologies, equity-centric. Absolutely.
Good. Now, I imagine as an executive that you probably sometimes have this challenge, but what are some unique challenges that women of color face in leadership positions, and what coping strategies have you adopted over the years?
We need, how long do we have for this conversation? There's so many unique challenges, I think, that women of color face in leadership positions. I mean, so even though we may have those background or the skills and experience, we have a hard time getting a seat at the C-suite round table.
Yep.
Even if we have that seat at the table, we may have a hard time getting, feeling heard, right? We may feel unseen or unheard. And oftentimes most of the time, we must outperform our male counterparts or female white counterparts to be evaluated similarly. And there's research, right, that has shown that organizations expect women to be more qualified than men for the same positions. And even for leadership opportunities for men, they come with more resources. If you look at more funding, more team size, supervisor compared to women leadership positions. So, we still work harder, and pay equity is an issue. So, there's a lot of, I didn't even talk about microaggressions as some of what is really, really a challenge that we face and still continuing to face, and not sure even whether others understand, right? So in terms of the coping strategies, I think forming allies, you tend to, where necessary, make it a teachable moment and maybe say something out and say, I think this may not be fair. In the past, I may have kept quiet, but more recently, I've been pointing it out and trying to say it in a non-threatening way, right? Because a lot of the time we come out as, oh, they're angry, or, I don't want to have that come out that way. And so in a non-threatening manner, you could voice your opinion and say, I think, this may be happening. And more often, they're willing to listen and do something about it. So besides taking mental health breaks and thinking about vacation or yoga or having a sisterhood, I think a coping strategy, definitely mental health, strategy, but one of the ways is to talk about it, and not really keep it inside, and have like a support group, and support each other.
Yeah, vocalize, right? As gently as you can, but vocalize, right? That's
absolutely the message. Yeah.
So you mentioned earlier on about your granddad. So I imagine that he was probably one of your first mentors. But who are some other notable mentors that have helped to shape your career journey to date? I believe your husband, your late husband as well, I'm sure was a great mentor to you.
Yeah. I think I've had a number of mentors. One that I could think about who really shaped my public health career is Dr. Carol Garvey, who I worked with in Maryland. She was the health officer in Montgomery County, Maryland. Very smart, very down to earth, and taught me a lot about work in public health, preventive medicine, and even the local policies, right? So I would shadow her, and we'll go, and she'll be presenting in front of the county, the council, or even at the state level. So she did shape my career journey, and I had begin to realize how health policy was also important. I think at the NIH, I had a number of mentors, definitely Dr. John Ruffin, who was the director of the National Institute on Minority Health and Health Disparities, who also did a lot to really encourage me and advance the science of health disparities research. And Dr. Curie, they all did shape my career path. At the IBM, I've had an incredible team, an incredible support system and leadership that have all been supportive of health equity, supportive of what I've been doing around, data and evidence, including Dr. Kirby, who was my first boss, but also Dr. Gretchen Jackson, Michael Curry, who is one of our vice presidents. They all have been awesome and supportive, and really shaped my career and even the activities that I'm engaged in to date.
Wow.
So thank you for asking. Yes.
Wow. No, it ties back to obviously one African proverb. I don't remember which specific country, but it says it takes a whole village to raise a child, right? To raise a person.
I think a lot of African countries, yes, it does take.
Right? I think they say, I don't know, I know they definitely say it in my village.
It takes a village to raise a child, yes.
Right. So I think that mentorship, so many people have contributed to who you are today. But I think what I hear from you are the people that took the time to really listen and understand your aspirations and your need for intellectual curiosity and let you pursue those things. And I think that that's remarkable.
Yes, absolutely. Thank you. And network of friends and other researchers and inspired by them. But thank you. We all need mentors. We all need coaches.
Yes.
In our career.
Yeah. I completely agree with you. And now my second to last question. Any technologies that you are currently excited about based on its potential for improving health literacy, access, or quality?
Excited about, potential for telehealth, but I'm optimistically cautious about it. But I am in terms of quality of care, right? Improving, leveraging our AI technologies and our advanced analytics. Because like you said, we all talk about how technology has tremendous potential to transform healthcare and address disparities if it's used appropriately, right? I mean, there's so much promise, so much potential to be realized. And, I think what we don't realize is that the health sector has generated so much large amounts of health data, right? That's driven by biomedical research, public health data, hospital data, all meaningful, right? But they're so large and so complex to be handled by just our own traditional statistical analysis or our software system. And the big data in healthcare is so overwhelming, not only because of its volume, but also because of the diversity. So our AI and advanced analytics should be leveraged, right? Because determinants of health are causes of diseases. They're so complex and they're really dependent on these multiple biological, environmental, sociocultural, economic factors. And we also know that we're all unique individuals. We have unique physiology. We have differential reaction to disease. And so we can no longer be able to, and that we need to now leverage these technologies, these advanced analytics and AI, and bring it to the forefront to really sufficiently address the complexity, especially if we want to address health disparities. So I'm excited about that. I'm really excited about the potential of AI and machine learning. I just said optimistically cautious because
yeah, of course,
it depends on how we're using it, right? We need to think about centering equity in our tools. And I'm excited about the fact that we're all talking about it. I consider you a health equity champion, amplifying, around equity and diverse, and ensure that we are including humanity, empathy, equity into these essential tools and advanced analytics that we're building.
I love that.
AI and machine learning are only here to help augment our intelligence and really to make sure that we're addressing disparities and using appropriate and right data. And so it's really important for us to think about that and not continue with one size fits all, right? And And so I'm excited about that, but I'm excited that they are, you know, it's moving there. The field, the science of health equity is moving to be integrated into our AI and machine learning tools.
No, I agree with you on every single thing you've mentioned. I think that we have a lot of data on health information, but the data only as good as we can analyze, process, interpret it, and turn it into meaningful information
Right.
that healthcare providers can use to elevate and evolve our healthcare decisions. So that's really a very important technology, and it also helps with health literacy as well, because the more people are aware of these technologies, the more informed they are about the decisions that they make, right? Because we want the data-enabled patient as much as possible. So thank you for sharing this perspective.
Absolutely. Yeah.
All right, so my final question is the easiest one. Do you have any other comments or thoughts that you'd like to share with our audience today?
Well, I want to go back to the scientific innovation and transformation, because I think a lot about health equity. I think a lot about the need to advance that science, especially to inform science innovation. And I want to also mention that scientific innovation or change is not merely to improve upon the past, right? I think science innovation or this transformation that I'm talking about needs to carve out an entirely new path for our future. We need to think about something new, our policies, right, that are existing. Like we need more effective function, more effective operations for health equity and for the better. And so science innovation is it's like a butterfly. It's a transformation from a caterpillar. It's not just a better caterpillar.
Wow.
And so we're certainly looking for the butterfly.
Wow, a paradigm shift, if I may, that also integrates the 3 T's that you mentioned earlier, right? As it relates to translational, transdisciplinary, and also transformational. So thank you for bringing it all the way back home. It's been such an intelligent conversation, multiculturally diverse and interesting. And I could literally talk to you all day, but I want to save that for another conversation that we're going to have maybe in a few years. Hopefully you'll be okay returning as a guest on the podcast to tell us about this health equity mission.
I would love to.
Technological evolution. All right, that would be great. So thank you for the delightful.
I'd love to. Thank you so much.
I look forward to staying in touch, okay? Take care.
Thank you. You too. Thank you so much. And keep doing the good work you are doing, amplifying science. We need that.
You. Thank you. It's only through people like you
welcome.
that is possible. So thank you again and have a good one, okay?
You too. Bye-bye.
Bye.